Here at Heroes, we have a unique relationship with the Houston Fire Department, and we have asked one of their experienced paramedics to show you what happens inside the ambulance after an overdose. Here's my colleague, Ashley Mackey, who is a firefighter paramedic with the Houston Fire Department.
Thanks, Dr. Fadile. Welcome to my office. My desk has a sheet on it. The first thing I do for someone who has overdosed on opioids is to make sure to counteract the lack of oxygen overdose patients experience, so I put an oxygen mask on them and give them O2. Next, we do a full assessment to see where the patient is at that moment in time. I count their heart rate, breaths per minute, take their blood pressure, and assess their level of consciousness. I log all this data as a baseline to monitor and ensure that the patient isn't losing ground while they're in the ambulance. I need to make sure any remaining opioids don't overwhelm the person's breathing as the Narcan wears off. Then I'll start a line to put fluids into the patient's system. This is so I can easily give more naloxone, the drug in Narcan used to reverse the overdose. I can also use this IV line to give cardiac medications if the patient's breathing stops or they need CPR. Because the people who have had CPR or who are waking up from overdose frequently vomit, I'm also ready to protect the patient's airway with a special tool called a supraglottic airway device, so they don't inhale vomit into their lungs. While we transport the patient rescued, I continue to monitor the patient's vital signs and provide a comprehensive report to the physician when we get to the hospital. As Dr. Fadile will tell you, emergency department physicians use the baseline information to decide how to provide further treatment. Your willingness to provide care to someone who has overdosed on opioids gives them a chance to breathe again and gives me a better chance as a paramedic to get them to the hospital alive. Before I turn back to Dr. Fadile, let me remind you of two things. One is you can give Narcan to anyone who is unconscious for any reason. And two, do not squeeze the plunger of the Narcan until the nozzle is in someone's nose. Dr. Fadile will now discuss what happens at the hospital when someone overdoses on opioids. Thanks.
Thanks, firefighter paramedic Mackey. As paramedic Mackey said, a lot of things need monitoring and treating when someone overdoses on opioids. When the person who overdosed gets to the hospital emergency room, I look at their current situation and see if the person is improving or worsening based on the report from the ambulance. For a patient who is improving, I start continuous monitoring to get beat-to-beat information about their body and evaluate for complications such as lung injury, brain damage, or toxicity from non-opioid drugs. I then treat the patient for opioid withdrawal signs and symptoms like anxiety, nausea and vomiting, diarrhea, generalized body aches, muscle pain, and high blood pressure. Basically, I help them through the agony of opioid withdrawal by making them as comfortable as I can. After enough time has passed, and based on which opioid they were exposed to, I start these patients on a drug that prevents additional withdrawal symptoms. For patients who are getting worse, and by that I mean who aren't breathing well or who are having other issues which affect whether they are going to survive, I start an IV with continuously administered naloxone to make sure that the opioids in their system can't cause their breathing to slow or stop. If the patient's not breathing well, I also place them on a ventilator to ensure they receive enough oxygen. In both cases, if the patient recovers well enough to be discharged, any person who has overdosed receives a box of Narcan, instructions on how to use it, and a referral to an opioid outpatient treatment facility. To illustrate why we make this referral for outpatient treatment, I'd like to introduce you to two of my colleagues here at the Houston Emergency Opioid Engagement System. First, Jessica Yeager, the Peer Support Services Supervisor and a recovery coach at Heroes, and then Dr. Andrea Yatsko, who is a faculty member and program manager providing outpatient treatment for folks enrolled in the Heroes Outpatient Opioid Recovery Program.
After someone has been rescued from an overdose, been treated at the hospital, and discharged, we reach out to each person who has overdosed on opioids. We work as a two-member team made up of a community paramedic like Ashley, who you met earlier, from the fire department, and a recovery coach like me. We use a list of people who have overdosed, generated by the fire department and go to the person's address and invite them to enter into our program. As Dr. Fadal mentioned, my name is Jessica Yeager, and I go out each week and help people all over Houston understand why entering treatment can improve their situation. I have lived experience with addiction, and I'm currently clean and sober, living a life in long-term recovery. I have dealt with challenges that people in recovery face, and I can talk to them and encourage them to establish new thinking and perspectives to help them achieve their goals. Overall, we work towards a goal of harm reduction and realize that recovery doesn't always happen on just one idealized path.
Hi, as Dr. Fadal mentioned, my name is Dr. Andrea Yatsko, and I supervise our outpatient treatment program here at Heroes, an opioid recovery program at the University of Texas Health Science Center at Houston. Once someone has agreed to enter treatment in our outpatient program, we provide counseling, both individual and group sessions, and long-term medication for opioid use disorder to prevent opioid withdrawal while assisting with long-term sobriety. We also assist people entering into recovery connect with safe, healthy, and sober living arrangements that allow recovery to take place, and also assist with info about signing up for health care benefits they may be eligible for. Our program provides continuing support from our team of recovery coaches like Jessica and her team, who help with the genuine challenges faced by somebody in recovery, and clinical staff who create a treatment plan and set goals with all patients. Overall, people who enter treatment for opioid recovery have success rates similar to the treatment success rates for other chronic diseases such as asthma, diabetes, and hypertension. The inclusion of medication therapy helps avoid physical withdrawal symptoms, as well as providing stability for the brain and body to repair from active addiction. Our recovery coaches, clinical chemical dependency counselors, nurse practitioners, social workers, and coordinators work with people in opioid recovery to help achieve the harm reduction goals people establish for themselves. The person who overdosed on opioids has an opportunity to change, to address their opioid use disorder with the support of medication, clinical staff, coaches, and counselors, which greatly improves the chance of reaching each person's goal for recovery.